Hi, in this video let's see a few important points in oral histology, and as you can see we have different tissues, and let's compare these tissues in terms of their origin, in terms of the nature of tissue, the formative cells, degenerative cells, the mineral content, sensations or sensory supply, and also the vasculature. So let's start with enamel, and the origin of enamel is chiefly ectodermal, right? Whereas dentin and cementum, they are ectomesenchymal. So both dentin and cementum, the origin is ectomesenchymal, whereas bone, it is mesoderm. So this is pertaining to their origin. And then coming to nature of tissue, enamel is epithelium, it's epithelial, whereas dentin, cementum and bone, they are connective tissues, right? And then coming to various formative cells. So in enamel, the formative cells are ameloblasts, whereas in dentin they are odontoblasts, and in cementum they are termed as cementoblasts, and in bone they are osteoblasts. Right? And now coming to various degenerative cells, we have, so all the tooth tissues, they have a common degenerative cell, that is odontoclast. So odontoclast in case of enamel, dentin and cementum. In case of bone, it is osteoclast, right? And then coming to mineral content, so enamel has the highest mineral content, right? It's around 96%, whereas dentin, it is around 70%, and cementum, it's around 45 to 50%, and bone, it is around 50 to 60%, right? And then coming to sensory supply or sensations, so enamel has no sensation, whereas dentin has terminal nerve ending, so there can be sensitivity when we probe dentin or when dentin is exposed, right? So it has sensations, whereas cementum, it has no innervations, so no sensations whatsoever, and bone, it has sensations, it has plenty of nerve innervations. And then coming to vasculature, enamel, dentin and cementum, they're all avascular, so no vasculature. However, the dentinal tubules contain tissue fluid, and the tissue fluid permeates or percolates through these dentinal tubules, right? And in case of cementum, the cells of cementum are supplied by PDL, periodontal ligament, through diffusion. And then coming to bone, it is highly vascular. So to summarize, here I have taken up different tissues and compared them in terms of their origin and various other factors. If you observe, enamel has its origin from ectoderm, whereas dentin, cementum has its origin from ectomesenchyme, including pulp, and bone has its origin from mesoderm. So the nature of tissue in case of enamel, it's epithelial, whereas the rest of the tissues, they are connective. And formative cells, as you can see, we have ameloblasts in enamel, odontoblasts in case of dentin, cementoblasts in case of cementum, and osteoblasts in case of bone, whereas degenerative cells are odontoclasts in all enamel, dentin and cementum, and osteoclasts in case of bone. And mineral content is highest in enamel at around 96%, and in dentin it is around 70%, and in cementum it's around 45 to 50%, and in bone it's 50 to 60%. And these are various nerve innervations and vasculature. So enamel and cementum, they have no nerve innervations, whereas dentin has terminal nerve endings, so there can be some kind of sensitivity. And bone, it's highly vascular and also richly innervated. And coming to vasculature, enamel, dentin and cementum, they have no vasculature whatsoever, right? So these are various differences which you can encounter in various oral tissues. And now let's see few multiple choice questions pertaining to this topic. So based on the topic we discussed now, let's see few multiple choice questions pertaining to this topic. So coming to the first one, it's actually asked in PGI 2006. The question is, tooth develops from option A, ectoderm, mesoderm, option B, ectoderm, option C, mesoderm, and option D, ectoderm and endoderm. So as I already said, enamel develops from ectoderm, dentin and cementum develop from ectomesenchyme, and pulp also develops from ectomesenchyme. So the appropriate answer is, it's ectoderm and as well as mesoderm. So option A, right? And now let's see another question. Which of the following is not an ectomesenchymal derivative? So more or less the same question. So enamel has its origin from ectoderm, whereas dentin, cementum and pulp have their origins from ectomesenchyme. So the answer here is enamel. So the question is, which of the following is not an ectomesenchymal derivative? So A, B and C, they have ectomesenchymal origin, except enamel, which has its origin from ectoderm only, right? And this is the question which was asked previously in AP 2007. So these are some of the model questions pertaining to this topic. Thank you.